Hello, my name is Ashton Phillips, student at Houston Baptist University in class Counseling 6323 CO2 Crisis Response and Trauma Care for Dr. Katherine Pang, and this is my video response for different disaster phases. For this video response assignment, I was asked 3 questions. What are the needs and challenges of the heroic phase? The honeymoon phase, can include a crash point. Describe who, when, and why this may occur. And last but not least, during the disillusionment phase, fear, anger, and hopelessness can set in. What types of clinical conditions may develop from these circumstances, and what type of treatment is best to overcome them? Well, just for a quick little overview on the different phases before I answer the questions. The heroic phase of a disaster response is when people display adrenaline-induced rescue behavior and high activity with low productivity. Basically, this is like right after it happens and everybody is acknowledging the disaster that occurred and are ready to go out and help and assist those in need and those that were affected during the disaster. So, to answer question 1 about the needs and challenges of the heroic phase, the overall theme involving the heroic phase is there's a lot of denial going around, whether it's from the people that were impacted or the people that's going out to help. But to be more specific, people deny the impact the disaster is having on the homes, families, and themselves. Like I said, there's a lot of denial on all those involved. Also, people utilize extraordinary measures to protect their homes and families while also stockpiling community assets. So those last 2 are the needs involved in the heroic phase. With the whole denial thing going on in the heroic phase, it's like when people ask you how you're doing and you really are struggling and going through things, but you don't want to burden somebody else, or you just really don't want to open up about it all. So you just give a simple little, oh, I'm doing all right, or I've been better. It's a lot like that. Lots of people aren't really necessarily gonna want to say, oh, sorry about that. A lot of people aren't gonna want to, they're just gonna leave it like that. Okay, a lot of people aren't gonna want to say, oh, I lost everything, or admit how much they lost or how much is really going on, especially when they don't have they feel like they don't have a resource strong enough or any resources at all to come and try to help them. So they just try to deny. They usually just brush it all to the side and just deal with it as it is, I guess, if you wanted to say it like that. Also, to go along with it, they're a lot more open to concepts of spirituality and religion. A lot more people might look towards the God, or if you're not the religious type, spirituality in whatever form that may be, and you look to that as a source of strength or a way to hope for more, better, for that help will come or things will get back to normal, things like that. So, for the second question involving the honeymoon phase, just for a quick overview of that, or have to write it down over here. The honeymoon phase is the phase where there's a dramatic shift in emotion. Disaster assistance is readily available, community bonding occurs, and optimism that everything will return to normal quickly. It's called the honeymoon phase. It's when everything is all nice and sweet and cute, real, what's the word to say? It's like the bad is covered up, you don't see any of that, you just see the good. And so, yeah. So for question 2, the honeymoon phase can include a crash point. Describe who, when, and why this may occur. Well, for the who, those who experience the crash point, are usually the rescuers and those who and the volunteers and those who go out to help those that are in need and that were affected. They the the win the win is after the heroic and honeymoon phase. After all of those things have come and gone, everything starts to come into place, and you start to experience fatigue and everything of that nature. You start wearing down a little bit. You start to experience a little bit of burnout from everything going on. You've been going around helping so many people, or doing this and that every day consistently back and forth, and you giving it all you got. Eventually, you're gonna get worn out, and so on and so forth. For question number 3, we have the disillusionment phase, where negative reactions such as physical exhaustion and substance use begin. People start to recognize the limits of disaster assistance, and the gap between needs and assistance increases, leading to feelings of abandonment. So, question number 3 was, during the disillusionment phase, fear, anger, and hopelessness can set in. What types of clinical conditions may develop from these circumstances, and what type of treatment is best to overcome them? Well, in situations like this, you go on to deal with typical mental illness things such as PTSD, anxiety, and depression. So the way you would want to go about helping those that would go on to become victims or experience anxiety, PTSD, depression, and even suicide are, you want to foster community versus isolation. In the disillusionment phase, a lot of people like to give up, and by the foster community versus isolation, once they start giving up, they stop wanting to help one another or possibly even trying to go out and receive help. People start focusing on themselves, or like the crisis workers and recovery people, and all of those people start getting tired of the whole assistance and help those out in need. They like from the crash point, they don't experience burnout or physical exhaustion. So now they burden with trying to do all of this help for other people, and they no longer have the strength themselves to go on and complete it or fulfill it. And so, yeah, you also want to encourage hope and healing through spirituality. Like we mentioned before, there are points where people look towards religion and spirituality for strength and guidance in these situations. And for the disillusionment phase, it is very heavy and a very strong phase for spirituality. A lot of people turn to those resources in this phase. Yeah. Next would be providing events and activities to help reduce stress. After a disaster, you so busy focused on trying to recover and get back to where you were or how things were. You don't really take time out of your day or for yourself just to relax and unwind. You done stressed out from everything you done been through, or what you done heard from somebody else going through, or seen what they've been through. So now, if you're the crisis worker, you done brought on a burden and a toll to yourself. If you're the person that went through it, you obviously have a toll or a burden. So yeah, you need something to do to try to unwind and keep yourself relaxed and calm and centered. Next, you would want to make sure, if you're this word for either or, and by that I mean like if you're the crisis worker or you're the one in crisis, but you want to make sure you refer people or try to get them motivated to go seek mental health help if that's what they need. Go to see a counselor, a therapist, whoever you need to see for whatever the reason may be. You might have lost someone, or it could just be as simple as, you know, lost everything else, or your house, a friend, or your belongings, all of that, you know, that's still important, that still takes a toll on you mentally and emotionally, especially if you went from being in a good place to now you're like, you lost everything, you don't have a place to live, no clothes, you know, things of that nature. So yeah, that can be real heavy on a person. You should go seek help and health, and take care of your health mentally, physically, and emotionally the best you can. And for the people that are, like I said, the crisis workers go on to experience burnout and all of those things, you want to make sure that all of those that are working in those areas, in those fields, are getting treatment for what they going through as well, because they're the ones that are going out there to help the people in need. But once they stop having the strength or the motivation to want to go out there to do it, not only are the crisis workers themselves suffering, but the people that depend and require them are going to ultimately suffer in the end as well. So yeah, the disillusionment phase is real big on psychological first aid, intervention, and suicide prevention. To conclude this video, I just like to say, for my references and for the answers, I got all this information, where I got all this information from. I got this from the Needs and Challenges of Disaster video by the HBU Online Course Development YouTube page. That was posted on April 23rd, 2019. Thank you.